Sentinel events related to falls rank in the top 10 of the Joint Commission Sentinel events categories. If somebody over 60 years old falls and fractures their hip, one-third of those patients will pass away and die within 12 months. One-third of those patients that fall and fracture their hip over the age of 60, one-third of them will not return to their baseline of activity. And then only one-third of them will make it back to their baseline of regular activity. So every patient in the hospitals, in most hospitals, it's pretty standard, is to do a Moore's fall risk score. So the hospitals will go in and assess the patient. They're trying to identify which patients are fall risk, which ones aren't. I would say that the literature shows anywhere between 20 to 30% of patients coming into a hospital will be deemed a fall risk. So you could have a 22-year-old that's a fall risk patient based on maybe some of the interventions we're doing. Maybe it's a post-op surgical patient and they don't have their mobility the way they should. Then what are you doing with those patients? You're trying to put them in an environment where you can minimize their risk for fall. And you're doing that with bed alarms, you're doing that with chair alarms, you're doing it with special color socks that the staff can visibly see that they're a fall risk and they shouldn't be up by themselves or alone. Then you've also got little tags outside the rooms. I've seen magnets hanging outside rooms to let people know they're a fall risk. You might have signs in the patient's room. Getting up to the bathroom, I think, is probably one of the major risk that is associated with falls. And really that comes down to the staff engagement, that comes to staff education, that comes to how are you treating the call lights. So patients hit the call light because they need help, they need assistance. And if it's taking 2, 3, 4, 5, 6, 7, 8 minutes to get in there and service that request, well, they learn from that behavior. They know it takes 5, 6, 7 minutes from the call light, and sometimes they can't wait to have to get assistance to go to the bathroom for 5 or 6 minutes. So I mean, they have good intentions. They just don't want to have an accident in their bed. They may not want to have. They've got a sense of urgency there that needs some assistance. So I think getting to the bathroom and toiletry is absolutely one of the primary reasons that we have falls. You would think that most of the falls are occurring in the evenings and nights when you have less staffing, but really it's pretty much spread out evenly. But if you had to decide which was occurring the most frequently, it's actually day shift.